Our next speaker is Nha Tran, presenting her talk, Challenging the Prescribing Culture. She's from Da Nang, Vietnam, and is pursuing a PhD in clinical pharmacy translational science at the College of Pharmacy. Growing up in Vietnam and living in Australia and the UK, Nha has always dreamed of experiencing heavy snow. Now that she is living in Michigan, y'all know where this is going. Nha realizes the snow is undeniably beautiful, but dealing with its volume and frequency can sometimes be overwhelming. Thus, this has led her to believe that too much of a good thing can be a bad thing. Please welcome Nha.
Have you thought about the possibility of taking less medications? For many older adults, especially those with chronic conditions like arthritis, diabetes, or high blood pressure, this question rarely comes up. The idea of taking less medication feels counterintuitive. More health problems, more medications, right? That's just the way it is. But is it? Let me give you some numbers. More than 40% of older Americans take at least 5 prescription medications. Nearly 20% take at least 10. This is alarming because the odds of experiencing a severe reaction increase 7 to 10% with each additional medication. And as a result, every day, 750 older Americans are hospitalized due to side effects from one or more medications. That's like filling 2 jumbo jets with passengers and crash landing every single day, not because of a lack of medicine, but because of having too much of it. Sometimes more medications don't mean better health. Sometimes more medications can mean more harm. Let me share with you a story that brought this problem home for me. My mom is 67 and has lived with type 2 diabetes for more than 25 years. Like many in her generation, she strictly follows doctors' directions, including taking her diabetes medications, especially when her mom died of a stroke and her sister have diabetes with complications. Before I show you a photo of my mom and her medications, I would like to share with you a little secret. So I used to be my mom's favorite. Well, I haven't told that yet. And then this little guy came along. He's my nephew. His name is Sheen. He's adorable, right? The heartbreaking part is that my mom completely traded me in for him. As a payback, I left Vietnam for the US. Top break, I know. Oh, by the way, my mom doesn't know that I'm sharing this with you. But if she's watching from Vietnam right now, she probably does. So here are the photos. The one on the left was taken about 5 years ago, and the one on the right was taken last year. In the picture on the right, my nephew is helping my mom take water with her diabetes medications. Let's look at the corner where she keeps all her medications and supplements. If you're thinking, that's a lot, you're not alone. I thought the very same. About 6 months before I left for the US, her doctor doubled the dose of one of her diabetes medications. The goal? To lower her A1C from 7.6 to less than 7.5. A1C is a biomarker of blood sugar control. Lower A1C, better health. Simple, right? But soon after, my mom began experiencing symptoms of low blood sugar, shaking, dizziness, and sweating. At first, she thought, well, my doctor told me this might happen, and I know what to do. She would take half a cup of orange juice or 6 large jelly beans to get her blood sugar level back up, exactly like what the doctor told her. But those symptoms kept coming back, and she couldn't deal with them anymore by herself. Her quality of life decreased, all for the goal of having a low A1C level. So I decided to take action. I took her back to the doctor because I knew she was overtreated, and we got to do something about her medications. I remember sitting across from the doctor, feeling nervous. What if he said no? What if he thought I was just an overreacting daughter, meddling with his medical decisions? But if I didn't speak up, she would continue to endure those troubling symptoms. So after explaining to the doctor what happened, I asked, should we lower the dosage back to where it was before? I was ready to show him a list of evidence of my suggestion. I had done my research, and I was prepared to enter a tough conversation. To my surprise and relief, the doctor listened, because he understood that for my mom, having a low A1C less than 7.5, the risk outweighed the benefits. And just like that, those bad symptoms disappeared. This isn't just my mom's story. Nearly half of the 6.5 million older adults with diabetes in the US are overtreated with medications. Overtreatment isn't just a matter of inconvenience, it's dangerous. In the case of diabetes, overtreatment leads to dangerously low blood sugar, just like what my mom experienced, falls, confusion, or hospitalization. Imagine ending up in an emergency room, not because you missed a medication, but because you were taking too much. This experience made me wonder, why aren't we talking more about this? How can I help people like my mom who are overtreated but don't feel empowered to ask their clinicians about taking less medications? Overtreatment is a serious problem. Unfortunately, we are used to a culture of prescribing that tends to focus on adding more medications rather than asking the critical questions. Is it still necessary? Or could this be harmful? But no matter how daunting a problem may seem, there should always be a solution. What if we can challenge the culture of prescribing? What if we can empower patients to say, I don't think this medication is helping me anymore, or can we talk about other options? So the solution to our problem is deprescribing. Deprescribing means stop reducing or stopping medications that are no longer needed, or worse, causing harm. Research shows that when patients discuss side effects like low blood sugar with their clinicians, deprescribing becomes more likely. And yet, many older adults are reluctant to bring up these concerns to their clinicians. Some worry about being seen as challenging. Others assume the clinicians know best. While I agree that the clinicians are healthcare experts, they don't live in your body, only you do. And that's where patient engagement comes in. When patients actively participate in their care, when they feel empowered to speak up, amazing things can happen. So let's do a small activity. Raise your hand if you heard of medication called Xanax or Valium. Oh, that's a lot. I didn't expect that. So these medications belong to a drug class called benzodiazepine. It is a sedating medication that should only be used for short term because of its harmful side effects. However, it's not easy to tell people to stop taking benzodiazepine, especially to those that have used this medication for a while. So, a group of researchers in Canada developed a booklet called Empower. The booklet was designed to educate patients about the risk of long-term benzodiazepine use. They encouraged patients to talk with clinicians about stopping benzodiazepine. The results of those who received the booklet, 62% started conversation about stopping benzodiazepine with their clinicians. And within 6 months, 27% successfully stopped taking benzodiazepines versus only 5% in the control group that did not receive the booklet. And because of these impressive results, the Veteran Affairs has used the booklet in their system to reduce benzodiazepine use and achieve successful adoptions across many of their medical centers, such as Delaware, Pennsylvania. So, empowering patients to engage works. It's an effective way to improve deprescribing. Let's get back to the question I raised earlier. How can I help people like my mom who are overtreated but don't feel empowered to talk with their clinicians about taking less medications? And that's why I do research. And that's why I left Vietnam for the US. Not because I was replaced by my cute nephew. Not really. Side note, if you want to find an answer to a question, especially a challenging one, let's do research. My work focuses on understanding what motivates or holds back overtreated older adults with diabetes from having a conversation about deprescribing with their clinicians. By uncovering these factors, we can design interventions that make deprescribing a routine part of care. Imagine a healthcare system that patients of all ages are active participants in their care, not just responding to, "Do you have any questions?" with, "No, I'm fine," even when you're not really, but instead saying, "I think this medication is causing me problems. Do I still need to take it?" This isn't just about taking less medications. It's about creating a healthcare system that listens, one that prioritizes patients' voices as much as hitting numerical targets. Addressing overtreatment won't just save lives. It will improve them. It will eliminate low-value care, reduce healthcare costs, and most importantly, help people live the lives they want, not the ones affected by overtreatment or medicine-related problems. So, if you are a patient like my mom, or a caregiver like me, probably not quite like my nephew, at least not yet, remember, you have the right to ask questions or raise concerns. And if you are a clinician, consider how you can create an environment that invites these conversations. And as researchers, we are committed to paving the way to make this happen. Together, we can transform the culture of prescribing. Thank you.